This would really be my advice for you, that all the jobs you carry out under your responsibility, that you make your personal documentation for your own sake. So what I would like to look at now are different socket designs, socket concepts when it comes to transfemoral prosthetics. And the development of transfemoral socket designs over the time, from the plug fit to the quadrilateral. And then long we discussed who made the research on the adduction angle of the femur to the most contemporary socket design. We should be aware of how the muscle groups are distributed in a transversal cut in our thigh. He has his thumb in the concavity, he has his thumb there in the scarpa triangle like in a quadrilateral. The adductus longus tendon is in the turn of his finger, but he is putting his index finger under the ramus. He's more punctual on the ramus itself. He's not taking the whole ischium bone into consideration. Yeah? And you see he's also a little bit more to the frontal aspect. Like this we wait until the ramus relief is set. We wait. And you will see we do this in two phases. We only take care of the ramus relief, and once this is set, I keep it, I hold it in place to make sure it will not move anywhere. And your job will be to control the sacrum being flat on the surface of the bed. For that I put my fingers under here. I have my fingers on the sacrum here now, and in the moment when his pelvis is trying to tilt, I will feel it. So now I ask him to pull his leg more and more and more and more, and here's the point where you can even see it in his case. Here's the point where his pelvis starts to rotate. You see? Here's the point where the pelvis starts. You see? Up to this point, you have him pull the sound side. The pelvis not rotate. It needs to be a fixed circle, fixed pelvis. And then you measure the amount of flexion. In his case, it's 0. If he would have a flexion contracture, this would come up like that. If there would be a contracture, you would see the angulation. We are going to take this circumferences. Like this, I measure 44.5. Now we take the ml measurement with my ml caliper. So remember, I'm now trying to follow the ramus, and I'm going to palpate this now. And he's not. No, you relax, please. Yeah, relax. And like this, I'm creating the bony lock. Okay, and I feel his ramus here very, very low. And I'm using this now to take.
Is the pressure always directly on the femur?
Subtrochanter. Okay, here we are. Look, I'm trying to apply the Schubler horizontal. His pelvis should be in balance. His thumb should be in the normal adduction. And I'm trying to set, and I'm trying to keep my Schubler in a horizontal manner and corresponding to the line of progression. And this is why we have the belt here, because now we can attach it to the belt and this is not going to crash down. And now I'm going to distribute this here a little bit to make this smooth. And you see my hand is not straight, my hand is following the bone, the 30 degrees of the bone, pointing 45 degrees upwards. My other hand is only holding the femur in adducted position. All we do now is to cover the relief of the ramus, nothing else.
Jedini cilj ovoga je da dobijemo
As accurate as possible.
ramusa što je moguće preciznije.
I have more responsibility, but I have the easier job.
Imam veću odgovornost, ali mi je lakši zadatak.
Još malo. Okay. Everybody will do this a little bit differently.
Svako će to raditi na svoj neki način.
And remind me that then we come back to the, who mentioned this with the dorsal pressure?
Za dorzalnu stranu.
Who said that?
Ko je pitao? Aris.
I like that you put the attention on the materials on the platform.
Sviđa mi se što si to lijepo pregledao na platformu.
That honors you.
To ćeš na ispitu bez izgleda.
It's always important that you cover the three-dimensional aspect of the ramus.
Uvijek je važno da trodimenzionalno obuhvatite ramus.
You need to know the distal end of the ramus. You need to know where's the tuba.
Gdje se nalazi tuba.
Okay. I would now apply a vertical line frontal and a vertical line sagittal as a reference for better orientation. And there's a third line we are going to apply distally, the line of progression. So I know the direction. Who is where? Yeah, here you are. Look what I did now. The concavity I created here on the gluteal area. This is creating already a longitudinal socket shape. You have very little job for the modification. Here are my desired circumferences.
Ovdje su mi željeni obimi.
Just try not to be too much under it at the end, where you in your socket did not make enough space for the bone to exit the socket comfortably. It is absolutely clear that we have the ramus inside our hands imprint now. Okay?
Ma spusti ovako, tek kad spustiš dole. Neko će nam pustiti. Jedino što možeš tu, ma ništa. Ništa ne možeš. Čekaj, čio. Evo mi je ovdje ivica. Vidite.
Every knee has a different reference. This is now our four-axial knee. Quite a good knee. When you go on this reference.
Pratimo tu referencu.
And definitely this is not a good alignment.
Definitivno znači ovo nije dobro centriranje.
And why? Because you divide your foot in 3/3.
Podijelite stopalo u 3/3.
And your reference is there where the second to the last third
vaša referenca je u
transfers.
drugom dijelu.
And my pylon is also lean backwards now. So obviously, whether this is not done yet or this is designed for a higher heel heights or whatever. My alignment line, my weight line, my reference is 15 millimeters in front of the axis. Now I'm moving it here. Oh, the socket, of course. We move the whole thing here.
Morate osigurati da vam je ležište u ispravnom položaju.
And it's always a challenge when it is a new socket.
I uvijek je izazov ako je to novo ležište.
Because he doesn't know how it needs to feel.
Jer klijent ne zna kako treba da se osjeća to.
Pokušat ćemo da...
About the heights of the prosthesis, and also this looks very good to me.
To izgleda i dobro.
Yeah, it's 15 millimeters.
15 mm.
Okay, and this is for the time being
Trenutno, nakon ovog što smo vidjeli,
the static
To je
alignment, I call it.
statičko centriranje, ono što ja zovem.
Check the height, I check the
Pravili smo
volume,
visinu, pravili smo zapreminu,
we check the comfort,
pravili smo udobnost,
we check the trim lines,
pravili smo rubove
we
ležišta,
know the ramus is inside.
znamo da je ramus unutra.
If I have, if you walk slower, the problem is not so severe. But
Problem nije tako strašan ako bude sporije.
It's a little bit turning.
Sad